Okay, we are live with another conversation here on FlareVet. Super excited today. I have wanted to have this chat with Dr. Lori Taylor for a long time. I'm very, very passionate about the importance of the physical exam and how that impacts our medicine and how that affects the reach of telemedicine in our patients. And I think I have the perfect person to pick her brain about this. I passed AVMA president 2022, 23. She received the AVMA award 2025. That's pretty cool. And then I'm in Texas, so obviously everybody in Texas really respects her. But her work at A&M, the first full telemedicine veterinarian, I think, in academia. And she developed the program there. We'll talk about a little bit about that probably later. Um, and and I think the main accomplishment is being the vet for the mascot at A&M. That's probably it's a pretty cool thing. Like very brings you close to the students and the faculty, and that's their pet for the whole school. So I think that means a lot, at least in my world. And then today we have Chris and Bill joining us from our regular roster. I think Dave is on a little bit of a vacation, which he deserves. And then I think Greg has some things going on. He might show up on his phone later, maybe. Hopefully not driving, or at least paying attention if he's driving.
He just lectured at AVMA, as did Dr. Teller, I might add. But yeah.
That's true. I mean, I don't mean anything, but I feel like I tell so many people, like, I'm going to speak here. And I'm like, oh, yeah, okay. I'm starting to get to know the world a little better of the conferences and all that. So, I'm super, super honored. So, I wanted to start the talk about the physical examination and the importance of that, because I think that's going to be the bottom line for me on how telemedicine, which is our main topic, it's done in our patients, because obviously they can't talk. So you're having a consultation with a patient that can't talk, and then you're depending on a video screen. So how important is the physical exam in our patients, Dr. Taylor?
I think the physical exam is fundamental to what we do as veterinarians. Not only can our patients not talk, and as Bill is living right now, infants can't talk either, but there are ways to communicate, and a lot of people don't recognize that our animals communicate with us, but not the same way that people do. So if you have an infant with an ear infection, they're crying, they're not sleeping, they're tugging at their ears, they're letting you know that something is wrong. Whereas our pets do everything they can to hide whatever the symptoms are. So if it's an ear infection, maybe they're scratching, shaking their head, things like that. But it's going to be pretty far along before they show those signs, because they don't want to let on that there's an issue there. So I think the physical exam is fundamental. People talk about, oh, we can just give them some ear medicine, it'll be fine. Forgetting that ear medicines have side effects. Is the eardrum intact? Things like that before you start putting different things in there. Bladder infections are a big problem. A dog is urinating blood. If it's a young female, first time that's ever happened, the guidelines tell us you can probably treat that without doing a whole lot of diagnostics. But if you have an older female, a dog that's not spayed, a male dog, other signs going on, then you're going to want to do a physical exam and get some diagnostics before you just start randomly throwing medication at that animal. And we need to be judicious about the antimicrobials and medications that we're using as well.
And I see it in part, we write our medical records as soaps, and the O part, the objective part, is, if you break it down, it's a fourth of what we're documenting and doing. And so for me, it really, the owners can say something in the beginning, you can get some clues, but a big part of how the medicine is going to go is going to be that objective part, where we're putting our hands on that animal, we're watching how they react to our touch, right? How they react to our feeling their body, how we manipulate their body, right? And I feel like that would be really challenging for me to work or have a client like Chris, for example, like, hey, Chris, bring your dog on the screen and let's let's see where the pain is in the leg. Can you hold the dog and pull on the leg? And where does it hurt, Chris? Where do you think? So
if you want, I can go and get her, and we can do a test run.
I have an idea of how it's gonna go. I don't know that I.
And I bet we follow the guidelines this time. I also think so much of our physical exam is physical, right? Like we're listening to the heart, we're manipulating the joints, we're palpating, we're looking, we're I mean, it's pretty. Once you get good at it, you can usually predict a torn ACL from 20 yards, but you can't really diagnose it without a drawer sign, without a tibial thrust, right? So I don't know. I just, when people talk about telemedicine and replacing the physical with a phone call or a video call, it's like, man, I do a lot of work with my ears and my hands and my nose, and like it's not just a a history extended.
Right.
No,
and think about
it'll impact what you do later. Go ahead, Dr. Teller.
So think about, they come in and they say their dog has abdominal pain and it's hunched over, and they're just determined that something's wrong with the dog's abdomen. And it turns out it's referred pain from the back. But you're not going to know that that's what it is until you've palpated this dog's abdomen and its spine. Or it can be the flip side of that. They think the dog has hurt its back because it's hunched over, but it turns out it has pancreatitis. And you're just not going to know until you put your hands on this animal.
Correct. And we talk a lot about feel, but smells sometimes help us a lot, with physical exam. Like a dog with a ammonia breath is going to trigger a little bit of maybe a renal workup, or you know how it is. Sometimes you're sitting there, the person in the room has no idea. They just brought the dog in.
Right.
What are you going to depend on in that moment on the physical exam, right? So that's how I feel like our craft is very special in the sense that our diagnostics, our treatments are going to depend a lot on that physical examination, way more like when I go to my doctor, he barely touches any part of my body or checks anything. They kind of wait for you to say something, and then okay, let me feel your belly, that hurts, or my ear hurts. Okay, let me get my otoscope. It's not like we do. We're supposed to do an exam. Some clients come in saying, I want a nose to whatever, tail exam, or the value of that, I feel like needs to be emphasized in how we talked about what we're doing with telemedicine and telehealth, because I think we could miss a lot of things, and we're probably going to talk a little more about like the caveats and downsides of not being able to do that physical exam. And I think telehealth versus telemedicine, I really like differentiating those two. I feel like some people have told me, dude, like you're talking about the same thing, and like one is just under the other. Like you're just talking about the same thing, and I really don't think so. Like, can you talk a little bit about that, Dr. Teller, about like what telehealth is, and then what's telemedicine really within that umbrella?
So telehealth is an overarching term. So it encompasses essentially remote healthcare, and that can be teleadvice. So you have somebody who's just gotten a new puppy and they need help with house training, or understanding that their new puppy, when it's passed out sleeping and it starts making jerky noises and whining noises, that it's dreaming, that it's not having a seizure. So teleadvice would be part of telehealth. Teletriage, so the dog that just ate that entire bag of Hershey's Kisses, you can triage that pet without actually doing the full diagnosis, treatment plan, what have you. Teletriage will be part of it. And then you have telemedicine, where you are making a diagnosis. making a potential treatment recommendation, things like that. So there are differences all under the umbrella of telehealth. I think the other thing that people forget, especially when doing that initial exam, you've never met the client or the patient before, so to establish that VCPR, is when you're in a room with the client and the patient, not only are you doing that physical exam on the patient, but you're evaluating the relationship that that client has with that patient. How are they bonded? Is the client scared of the patient? Is this an aggressive dog and they may not be comfortable handling it? Things like that. Are they going to be capable of giving it a bath twice a week if it has some kind of skin disease? Or are they going to be able to give it the medication 2 or 3 times a day? So also being able to evaluate that relationship is a really important part of the VCPR and learning what that looks like, particularly at the first visit.
You mentioned the VCP. Go ahead, Bill.
I had a question because I think I might be jumping ahead in this conversation, but I think I and I'm a guy who's got 3,500 clients or something, and a lot of them have my cell phone number, right, in my little town.
Mm-hmm.
So, but like I like it because it's like people text me like, "What do you think?" I'm like, you need an ER right now," or like, "I'll see you tomorrow." And I'm a fan but never for strangers, right? Like never for an animal I haven't laid hands on.
Right.
Mm-hmm.
So, but telemedicine, not just telehealth, but like telemedicine is being billed as an access to care solution, and
Right.
I broadly disagree for a variety of reasons. But can you speak to like where telehealth, telemedicine, and teletriage fit in that access to care conversation? Because I think they do.
They do. Agree. So like the telehealth / teleadvice, teletriage piece, they can reach out to you. So again, like these people that you dealt with that have your cell phone number. I mean, if somebody just needs general advice, like, and it happened 3 times while I was at AVMA just over the past few days. One, somebody's eagle ate a 20-pound bag of its dog food.
Wow.
Shocking that
Not
it's a beagle,
surprised. Yeah,
right?
shocking.
And it about doubled the weight of the beagle after it ate. But the dog's fine. It's 7 o'clock at night, and she wants to know, does this dog need to be seen?
Yeah.
And
That was the dog's best day ever.
right, exactly. And so we talked about expectations, what she needed to watch for, that the dog was going to wake her up several times during the night to go outside. But as long as it was fine and happy and wasn't throwing up, wasn't attempting to throw up and gagging like it had tours, all those things, just to watch it. And if it started taking a turn for the worse, then that would be the time to go to the ER. I was a client whose dog had 2 seizures within a 3-hour period. What do I need to do? You need to go to the ER. That we're not going to sit around and wait on. So those kinds of things, yes, they happen all the time. And so those would be triage examples. Generally tele-advice, my dog chewed a piece of Kleenex and do I need to worry about it kind of thing? No. So those things are a boon, especially if you are 2 or 3 hours from your closest,
Sure.
your veterinarian or
Yeah.
the ER, right? Is it worth making the trip? And the flip side of that is, of course, we don't want to send things to the ER that aren't true emergencies because they're already working. They don't need a non-emergency at 2 a.m. when they're dealing with a hit by a car or something like that. So there are advantages both ways to the teletriage. So the access care piece is huge. And not only from the distance, the geography, but financially, do you need to pay for that ER visit if it's not an emergency? Let's wait and use it for more appropriate diagnostics during the day. So it does play a role. And what we've seen with most of the people who are using telemedicine are using it for convenience. They're not using it because it truly is a burden for them to go see their veterinarian. It's just way more convenient to sit at home on your sofa at 10 o'clock at night.
Have somebody call in augmentin and that's it. Yeah.
Yeah. So.
And that's how I see it. You know how like we talk about AI being augmenting our work and kind of helping us be better. This is a similar thing, you know, where it's being marketed a little bit as like it's gonna replace and it's gonna replace your visit, and it's gonna, oh, your visit went so bad, I'm so sorry. Now you can do it on your computer. That is not the correct way of using telemedicine and leveraging better care. I think there's ways to leverage better care, and I started in 2009, and I feel like I've used telehealth for decades now.
Sure.
Like telehealth is not new. Telehealth is not Zoom calls and COVID. I used to do phone calls. We used to do emails. We used to do faxes.
Absolutely.
And that all of that is telehealth. So I feel like some people are trying to jump on it as if it's a good or a better way to practice instead of a supplemental or a complementary way to make us better. Right.
John, I'm going to highlight your work here because you've highlighted a lot of, in particular, Dutch Pet. I mean, we can't pick on, was it Fuzzy anymore, but, Dutch Pet is, the cost of vet care, the costly office visit. But it's like, a lot of good medicine gets done in that office visit. Like, cheaper and worse isn't better, right? Like, is usually just worse.
And that's my concern. Yeah.
Yeah, they make it out like the physical is bad, the exam is bad, the trip to the vet is bad. Like, there's a lot.
There's already a little bit of lack of trust happening in some places, not everybody, right? But I mentioned here, even like we're starting to kind of be seen as the mechanic. That's a joke, right? The mechanic, the lawyer type approach, right? Where you kind of like, hey, why are you charging me for this and that? And that they're just big red non-trust flags, right? And marketing like that just kind of makes it worse, and I feel like I can accept telemedicine when there's a veterinary client-patient relationship, and in individual states, if vets want to do it that way, if the veterinarians in that state feel like it's okay to have a VCPR through telemedicine, then cool for them, right? But don't give that power to the voters and the people that are voting in to change the law, that want to stay on the couch and do the vet on the couch and then wait a week for their medication. I feel like the voters shouldn't be the ones deciding how things are going to go. It should be the veterinarians and the veterinary staff and the people involved in the work. And I actually had a question about that for Lori. Do you think that making it state by state kind of takes away from the argument that the exam is necessary? And should the AVMA adopt a more global, national approach to that? Or you think the state by state is still the way to go?
Well, the AVMA's global approach is you should have that in-person VCPR, right, before you in-person physical exam and all of that. But the AVMA doesn't get to set laws, and those laws are all set at the state level for lots of things, human healthcare as well as veterinary care. And so it's just the way our system is set up. I do think it does lead to lots of confusion. And I think going back to Bill's point about the cost is, I don't think telemedicine makes veterinary care less expensive. I think it just shifts where the money goes. So the money is going to an online platform versus a brick and mortar facility. But the community still needs a veterinarian. And if they're losing money to other things, whether it's the online pharmacies, it's to a telemedicine platform, the various things, then that just results in prices locally going up because you still have to pay your rent, pay your staff, pay your utilities. And when people do come in to a brick and mortar for their pet is sick, they're expecting more advanced diagnostics. So that money has to come from somewhere. And so it's not that veterinary care is going to become less expensive for the overall population because we now have telemedicine. And when telemedicine is used appropriately as a tool, then certain things will be less expensive. And I know Greg's not with us today, but he had his great paper about doing follow-up surgical exams, post-op exams via telemedicine. And that's a great example. And there are plenty of other things that we can do with telemedicine to make individual visits less expensive and that can make it overall. But the key there is that continuity of care with the same veterinarian and not the fragmentation. I know people who have gone online, used a telemedicine platform, gotten whatever they've gotten, the pet hasn't gotten better. And so now they go see a veterinarian in person and they want a discount because they've already paid
Yeah.
money.
Not to me, not if it's other people.
Yeah, exactly. So no, I
Yeah.
can't give you a discount. You can go back to the original person you dealt with and ask for the discount. So then it can end up costing more money, but it's just a shifting of funds. It's not that overall veterinary care is less expensive.
Well, and I think it's also worth noting, and I don't think we talk about this enough, but like we're way better at this than we used to be. Even the last like 10, 15 years,
Mm-hmm.
like wow, look at the parvo survival rates. They've skyrocketed. Like that's amazing, right? Like I was looking at in the interest of making a point, I was looking at even stuff like ASA 1 and 2 patients from like 30, 40 years ago. Like the anesthetic death rate was 2 or 3 times higher
Mm-hmm.
for elective procedures, right?
Mhm.
Like we are like, okay, yeah, you want it to go back to the way it used to be. It was cheaper.
Yeah.
You tripled the chance your pet died, but
Yeah.
like I think we don't talk about that enough. People are like, oh, I don't want a lot. I'm like, you do. We're better at this than we were. Like, oh, I don't want chemo. I'm like, chemo will cure your dog.
Right.
Like, we will double the survival time. So with carboplatin or palladia or something. So I think we don't. In my experience, I spend a lot of time talking about how much, like, oh, our old dog, it didn't work. Like, yeah, it was the late 1900s.
Right.
Like, this is not the same. This is
Right.
not the same. And
Even
I really,
dental care. Look at dental care. I mean, we have
Sure.
proof that it helps our pets now.
yeah, tons of statistics, and we're better at it. Like, I mean, we're so much better at it. Like, it was rare to see a dental X-ray when I started, and now it's rare not to.
Mm-hmm. Yeah. We didn't even have it when I started.
Like, and that's honestly for me, access of care is way more about the economics and the demographics than distance. We're not in COVID anymore. I feel like some people still talk like we're in COVID times. This is way past post-COVID now. Like we're living a totally new reality. I wouldn't even talk about post-COVID anymore. This is just the present reality we're living in. Everything's gone up. Everything's more expensive. Like, I don't know what I'm going to eat tonight because I just got some gas, right? Like, I need to budget my dinner, Yep. But, it's a new reality. We need to adjust. There's options for clients for wellness care now. There's vaccine clinics that are completely acceptable. There's physical examinations and medical records and legit vaccinations that, okay, well, I get that maybe you can pay $400 at the vet, maybe a couple hundred at the feed store, but you're getting care for that dog. So you can't tell me that the access of care is about not being able to go to the vet. There's other options out there. And in my opinion, doing it through a screen is really the worst option, except when it's for continuity of care, where you're following up your cases, when your client needs to know if they need to come in or not, when there's a dose change and because or adding a medication because the dog's still painful. All those things for me are completely acceptable, but they come from an initial assessment of that dog, right? That it's in person and physical,
right?
And I feel like that's where it's really up to us veterinarians to really communicate that part of it and the importance of having that over the convenience of, just meeting somebody online and just kind of letting them know what's going on, and maybe getting some medication later, which that's another big part that I criticize about doing all of it online. It's like, you can't even send the dog home with medication.
Right. Yeah.
Your
So-
dog's in pain,
Or
you do a telemedicine call, and then
You
it's
can,
going to be in
like-
pain until when?
Yeah, until the pharmacy opens.
Right.
So Dr. Teller, you've obviously spent more time researching and learning and talking about this than John and I. What's your favorite like telehealth, telemedicine, teletriage success story? And what's your like favorite or least favorite telehealth, telemedicine, teletriage disaster case?
Oh, it's a great question. My favorite, actually, so at A&M, we had an access to care program, and
Mhm.
one of our programs is every month we went out to a rural county, same county, in conjunction with their shelter, and we saw pets belonging to elderly people on a fixed income in a community that did not have a regular veterinarian, and we provided care to those pets. So everything from the wellness, vaccines, heartworm testing, feline combo testing, all of those things, minor illnesses, allergies, ears, those things. And we had a man bring in his cat. It had been an outdoor cat that had been blind in one eye for 5 or 6 years. It had been a while, but it had recently gone blind in the other eye and had some snotty, sniffly nose, some hair loss and derm lesions. It also had fleas. And so we're looking at this cat, had tremendous scarring and growths on the eyes, looked very painful. Of course, we addressed the fleas and what have you. Did the basic eye exam that you can do, Schirmer tear test, floor stain, all of that. And I ended up doing a teleconsult with our ophthalmologist back at A&M, who was concerned about either herpetic keratitis or eosinophilic keratitis, made some recommendations for what we could do out here in the middle of rural Texas.
Sure.
And we did those things for this owner, and we said, we want to see when we're back in a month. If you have any issues, reach out before that. Of course, he didn't reach out. He came back in a month. The cat was actually worse. And he said, I can't give the medicines. And of course, it would have been helpful if he had reached out to let us know. At that point, we did arrange for him to go into A&M and see the ophthalmologist. And they did their thing. It was herpetic keratitis. Found a way to medicate the cat, which really involved using gabapentin first. Then you can medicate the cat. And if he had told us that on day 3, we would have just sent it to him. But the cat, we ended up restoring vision in that cat.
That's amazing.
And it's
Wow.
a great story to me because 1, it shows the access to care piece. 2, it shows how you can use a teleconsult. 3, it shows that just because you have all of this available doesn't mean the client will use it or understand it. And then when you put all the pieces together with the continuity of care, it works. And another example from that same clinic, a man had scheduled it for a wellness exam, brought the dog in. Since between the time he had scheduled and we saw it, the dog had started vomiting, was lethargic, what have you. Chose to hold off on the vaccines. We could not run our labs there at this remote location, but we did take labs, the blood back to A&M where we could run it, and the dog had pancreatitis. And so I was able to treat that dog as an outpatient, and we sent some of the medication we'd already dispensed while we were there, and we sent him the rest. And we did a telemedicine follow-up before we saw him again. And the dog responded beautifully, but we would not have known if I had not put my hands on that dog and got the cranial abdominal pain. from that physical exam.
Sure.
I haven't had a real train wreck from a telemedicine exam, mostly I think just because I've been practicing long enough to know what my limitations are. But I was contacted by a
Oh,
veterinarian.
it can be an anecdote. Like, it doesn't have to be your.
It's not going to be
Yeah,
mine,
yeah,
but
yeah.
this happened. This just happened last week to a colleague in Texas who had a client go online to one of the direct-to-consumer platforms because the dog was urinating blood, urinating frequently, all of those things. It was a female. And so they told him it was probably a UTI. They sent antibiotics and a non-steroidal to the owner. And 3 days later, the dog is actually worse. So they went and saw my colleague, who immediately put his hands on the dog and could feel the crunchiness. Could just palpate the crunchiness. Took radiographs. Of course, the bladder is huge and it's packed full of stones. And he took the dog to surgery and he took out over 200 stones on that dog.
Holy smokes.
So
Yes.
so that's a good point on like, so the examination is part of the consultation, and your hands is so much cheaper than an X-ray in terms of like the big picture.
Right.
And in that case, it's really what diagnosed the dog, right? You cannot confirm before you go in surgery, of course, but what diagnosed the dog was a physical examination.
Right.
And I have a similar experience where, and this is how I got involved and got so passionate about it, because I know in Texas we need the physical exam. And one of my clients, personal client, told me they had used a platform, and basically they were given two options: either the dog had a UTI or was dying. Those were the differentials. Okay.
Okay.
And I'm shocked listening to this client saying that, and I'm like just shaking my head, like either your dog's dying or has a UTI. Yeah, that's what they said, but then she started vomiting and she's not eating now for 5 days. It's like, crap. If we had started 5 days ago, maybe your dog had a chance. Now, I don't know.
Yeah.
Ran some blood, renal failure, which the exam pointed that way a lot, right? In the history. So, UTI or dying, actually had renal disease. So yeah, you were right. It was dying, and it didn't care. He didn't get care until 7 days later. So that experience is what made me think, like, man, if we multiply this times thousands of pets in the USA, this is not a good thing for our reputation, our trust. What I think is that that regular person in the street is probably thinking, this person's license, this is a veterinarian I'm talking to, this must be okay. This must be okay. And then from my side as a vet, it's like, I don't think that this is completely okay, and that's where I kind of like, I have been so vocal about this, because there are good things about telehealth, right? But the actual aspect of telemedicine, of diagnosing and prescribing without ever meeting this pet in person, I think that's where veterinarians should not give voters the power to decide that. And there's a reason, because we're the ones that have the knowledge and the experience on why. And I don't understand why, even other veterinarians are fighting to let the voters decide on how we practice medicine. And that's really heartbreaking, and it's kind of frustrating. And I feel like, I think the key is to get involved in your own state, in your individual state. And like I said earlier, if you guys want to do it that way in your state, and all the veterinarians, or not all, but the majority of veterinarians are okay with establishing a VCPR that way, then good for you. But at least in Texas, we're not doing it.
Well, and I think, the state boards and the licensing and all, the regulations exist to protect the public, right? Like, that's why that's why we have to be licensed. It's not for fun. It's because the state wants to make sure that the people who are doing things like this, that are, we play with live ammo around here, right? Like, those of us know what they're doing, that we're, at a certain level of education and, competence. And I think limiting the telehealth to, VCPR without a physical exam, I can't see how that's protecting the public because it's worse care.
Right.
And I don't think the states should, and I mean, like, I'm just one voter, but I don't think the states should opt for cheaper and worse. I don't think that does anybody, I think that hurts
And
more than it helps.
convenient and easy. Yeah.
Sure.
Right.
Yeah.
No, agree. There was a case in Louisiana. It went to their state board, and the veterinarian got punished because the dog had presented sick and vomiting, and the veterinarian advised them to use another medication they had in the house that had not been prescribed for that patient. That ended up, the dog got worse, ended up having to go to the ER, and the medication that had been recommended ended up making it more challenging for the ER vet to treat the dog. So that veterinarian ended up getting disciplined by the Louisiana board for that as well.
And I don't know how you feel about this part, Bill, but these companies are making millions out of a veterinarian's license, or a few of them. All the liability falls on the veterinarian and their license and their career. There's no liability on the company, really, because the vets are the ones there. They just have these employees of their 1099s that are doing the work, and all the liability falls on these veterinarians that are just probably trying to make a living. They're trying to make, a way to make some money and kind of support themselves and their families. And how do you feel about that part? Like good for them for working for them and trying, or should veterinarians kind of push back on this type of platform and not work for them?
I don't think they should work for them. I understand why people do, because it's easy. And sometimes you have financial difficulties or physical difficulties that limit how you can practice. And this can be an alternative. But I would push back against you that I don't know how profitable these companies are, right? Like Fuzzy went out of business rather abruptly. Like I don't know. I'm looking at Crunchbase now to see if Dutch Pet's even profitable. I like they get funding because it sounds good on paper, but I
And remember,
all,
they're limited. They're limited by different states, right? Like there's like what
sure.
Dr. Teller's like 7 states that allow it. So
There
that's
are
the
10
thing. They're gonna keep
10 states.
They're gonna keep pushing and keep pushing to get more states open to it, so that they can get profitable. And I think they're trying to survive now.
And I think they're like it's not that easy to like. You kind of need people to be pretty productive to make this work. And I was on a call with somebody who was like doing research on these companies, and they said, is this something you think your clients will be interested in? And I was like, well, you have a pet? And they said, yeah. I was like, would you take your pet to the vet to be examined, or would you feel comfortable doing it online? And she said, well, I'd take them to the vet. I'm like, there's your answer, right? Like, what's the better way to do this? The better way. Like everybody knows that in-person physical exam is better.
That's my fear, though, right? Like some
yeah,
people just want to be on the couch.
yeah, and like I can't like, but I don't know that. I really don't know if there are enough people who just want to be on the couch to sustain a company like Dutch Pet.
They
like
they're
Joe
way into
Spector,
that.
by the way. I invited Joe
Huh?
Spector to debate me at the
Oh,
AVMA
okay.
conference or at conference, and he declined. Sadly,
He
went on Tucker Carlson, but he didn't want a piece of me. So I was very disappointed with that. Standing offer, Joe, if you're listening, I'm up.
I think you're way tougher than Tucker Carlson. I'd be more afraid of you if I was him. How do you feel about that? How do you feel about that part, Dr. Teller? Like, do you think these companies would end up being profitable eventually, or is it something that you can just wait it out and it probably will just drop?
We saw on the human side that they became profitable, right? That they have to keep feeding the machine, but it's the companies that are becoming profitable. It's not the veterinarians. And it is just like on the human side, it's frequently people who are looking for extra income, supplementing their income, whether their debt is high, or as Bill said, they may have mobility issues or things like that. The companies become profitable by pushing tests and products. They're not the exam, as you've seen on some of the advertising itself that lures the client in, could be $15, or if there's a subscription that's, you know, $12.99 a month and you get unlimited access. But then they become profitable by product sales. And that's where they're making the money. And the concern becomes, are our veterinarians who are working for them being unduly pressured to sell a product or particular products, even if those aren't really the right choices or the most appropriate choices for the patient. And so that's where it becomes problematic, and all that liability is on that veterinarian.
So I'm looking up Dutch Pet right now. Dutch Pet is a annual only at $132 a year. They raised 20 million Series A and 18 million. Bringing total Series B was 18, another 5 million from Jimmy Fallon of all people. They got a total funding of 43 million. So they need 150,000 users active to cover that, and 150,000 people who are using it at least twice a year, so 750 a day. I mean, that's like running a full hospital. Like that's, like that's uh that's 20 consults a day. You get 30 or 40 vets, what, 40 with the math there, 800 a day. Like that's a pretty ambitious company model. Like that's a pretty ambitious business model. Like, do we really think there's 150,000 pet owners who are going to commit to $130 a year and then spend another 8?
I'm assuming
That's
they're counting on spreading it through the whole country.
sure.
That's what they're counting on. I think they're just surviving until they get the laws changed. I mean, there's a lot of even in Texas, there's lobbying right now to change the law. So they might be sitting around,
Like, don't swear by
Can
my
I
back
just
with nothing math, but like that seems pretty ambitious.
can I ask a question about this?
Sure.
What if this isn't about medical and it's about gathering data?
Well, what do we gather? What for?
We've seen it happen before, right, Bill, with online pharmacies.
Sure.
Why does Facebook gather the data so they can push advertising?
Sell it to other people. Yeah.
Right. So is there a sideline that the Series A and the other investors are finding some other technology-driven benefit and not medicine-driven benefit? And I don't know. I'm just throwing it out there as a possibility. As you're throwing the math numbers out that just don't make sense, it's making sense to someone. So what could it be?
I mean, maybe they're thinking I mean, it makes sense. It makes more sense for Chewy than for Dutch Pet, I guess. Because Chewy's got the sales platform to like back that. Dutch Pet, I don't know. Like, we're talking about, I don't know, 150 million a year in ARR. Like, boy, that's really ambitious for vet med. Like, I've never looked at the numbers, but man, I'd be sweating if I was Joe Spector. That's like,
well, maybe that's why they have to advertise so hard and so aggressive.
Yeah, I mean, members so if you need 500, if you're looking at 10, 20x, 200 to say venture acceptable exits 400 million, 20x which 10x what you raised. You need 750. You need 750,000 active members.
Yeah.
Good luck. I mean,
and then they have to pay their CMO like a lot of money to talk and advertise too. So
how many people does Banfield have on wellness play? Like, that's got to be a crazy high number, right? Like, this is one of those things that feels good on paper, but my long-term worry about these companies is just not very high. Like, I don't think like can this doesn't sound sustainable, but I spay cats for a living. So what do I know? Like I don't.
So good point, Bill. Like, so Lori, do you see a world where all the good or the only effect these companies had is to change the laws to allow video calls in the states, and then these companies are just not going to be able to handle it, and then the laws are all changed for no reason? Is that a scenario that you see, or?
Really hard to say. There are a lot of these companies out there. Many have folded. Some seem to have some more staying power. I think AI will probably come in and play a role. I mean, it already is doing some initial screening and what have you. On the human side, you don't always even have to meet with the actual healthcare provider. You fill out a survey just to see what it is that you may have a contraindication to something. And if you don't have the contraindication, you get what you want. So a lot of these people could probably crank out 40 patients in a 4-hour shift doing it that way. Telemedicine visits tend to be shorter than an in-person visit. Their average length is 7 to 8 minutes. So you can do those pretty rapidly. Right now, most of the states, I believe, require a telemedicine visit to be an audio visual, but if it could be a chat-based visit where you could be running 3 or 4 chats at a time to do it, you could certainly see a lot of patients in any given period. And, you know, even if that's costing the client $15, $20, $30, if you then sell $100 worth of product, that's going to add to the income stream as well.
How about staff members working under one doctor's license for the whole state? Is that something that could happen? Like, that's like my nightmare, is having companies that run the whole state with one license and then have this whole network between AI and telemedicine of just pushing cases through with one license. Is that a scenario?
I mean, I think we're seeing it happen. So it's, I mean, every veterinarian that's doing it has to have a license for true diagnostic and prescribing. So in that case, no, at least not yet, unless you're in a state where technicians are allowed to do that at some level. And I think there is a place for technicians. Technicians can definitely help, going back to the telehealth piece, with general advice, some of the triage things. Technicians, credentialed veterinary technicians are capable of helping with triage, just like they even do in our own brick and mortar practices. But ultimately, that liability still goes to the veterinarian who is providing that care. And so I don't think it's
I've
out
seen
of
companies.
responsibility.
So, for example, there's some hospitals here in Texas that the owners are in a different state, and the one doctor's license in Texas.
Yep.
And basically, the thing runs under their license because you have to be a veterinarian to own a clinic in Texas. So the guy's in New York, but he owns a clinic here because he's licensed in Texas.
Yep.
And I can see that scenario get really tricky if we're going to allow telemedicine and you know, multiple states and things like that. So that's just my concern.
No, absolutely. They do. Some of these companies have chief veterinary officers or, you know, regional directors that are licensed in multiple states, and that person doesn't necessarily live in the state, but that person's the one setting protocols and responsible for drug inventories and what have you too. But the veterinarian,
in theory, they could be sitting in New York doing the telemedicine for California because they're licensed in California. Like, how are we going to know where they're sitting? Or it doesn't matter, really.
Oh, yeah, definitely. That some states require the veterinarian to be in the state, not just licensed. But others just say you have to have a license. So, yeah.
I was looking at whose practice act. It was like Arkansas or Alabama's, and it required that you have a license in every state where you're, if in the state the patient lives.
Yes. Yes.
And so if you're on the border, you could need,
You'd have to
a
be
Texas.
both.
Yeah,
Yep.
and you like, so you couldn't see the patients from Texas
Right.
if you only had an Arkansas. I thought that was kind of interesting and strange because it was an Arkansas rule. I don't know if it was a Texas rule too, but like if somebody came from out of state, like if somebody was visiting from New Mexico, I couldn't help them
We've
in that
seen
state.
We've seen this, and actually, we've seen it with some of the specialty practices and academic practices
Mhm.
because people will travel, especially if you're in a state where you don't have a vet school or specialty practices.
Sure.
And so you travel and you see the internist or the surgeon, whoever, and your pet gets the help it needs, and then you go back home, but you need follow up. And that becomes tricky because you want to follow up with your specialist, but your specialist may not be licensed in the state
Hmm.
you are now.
Right.
So it's kind of a double-edged sword
Yeah.
as to what that looks like. But I mean, our border state vets have that right now anyway. I mean, most of
Sure.
the vets I know along any of the borders, like New Mexico, Oklahoma, Arkansas, Louisiana, will be licensed in both states just so even if they're just not even doing telemedicine.
I was for a long time. I'm 2 miles from the border, and I was doing enough house
Delaware.
calls for a while. I'm not anymore, but
Yeah.
like I was for a long time.
Yeah. I mean, you just have to do what's practical for your
Yeah.
personal situation for sure. So,
Well,
yeah.
we're coming down to the last like 10 minutes. I don't want to abuse of your time, Lori. Will, you have any questions that are left from your list there?
I do. I'm scribbling notes.
There you go.
Don't worry, nobody else but me can read them. I
That's a good thing, probably.
well, maybe there's some swear words. No, my last question for you, Lori, would be like, is there anything you want to like use this platform, modest though it may be, like to say to, we have a lot of vet students watch us, we have a lot of clinicians watch us. Is there something you want to, take 5-10 minutes to talk about?
I mean, I want people to use telemedicine. I want them to do it. I want them to offer it to their clients and make it available to them. And use it because I think the continuity of care piece is so important. And there are things that we can do to make it more convenient for our clients in certain cases by offering telemedicine as an option. So I don't want them to just say, no, I'm not doing it. I'm never doing it. My clients won't pay for it. I mean, there's proof. There's studies out there that show clients will pay for it. But do it for them so they're not going to look elsewhere. Because there are times where convenience and appropriate treatment can be done together. And then, of course, there are times when it's not appropriate. But I'd much rather people do it. And I think it's even more important to provide it as a part of incremental care, especially if you have a client who can only afford a certain amount of money each time and can't do everything all at once. That continuity of care is so important. And so if you see them in person, you've done your physical and you've outlined a plan where we're going to try this and this. And if that doesn't work, then we'll do this and this. And you can use telemedicine as a part of that. And that means people are not having to take time away from work or finding childcare or bringing all their kids into the visit, all of those things. So I do want people to embrace being able to use telemedicine, and I want them to do it with their clients and keep that money in their own practice versus having it farmed out to other places.
And that's a good
Sure.
point. I do believe in it. I think it's really good for a lot of things and a lot of scenarios after you've established that relationship. And I feel like we've been doing it for decades now. It's not anything new.
Sure.
I think the new thing is that we have Zoom and video screens and that helps with some aspects of it. You get to see the dog, you get to see their environment, you get to see where they live, you get to see them in a more relaxed state, maybe, and you get some extra information, but it's not like it's not changing civilization, and and it's not changing like this dramatic impact. You know, it's kind of in a way I see AI too. Like, you know, some people talk about AI like it's revolutionizing veterinary medicine, and maybe not. Maybe we have to tone it down to it's helping us do a better job, being more organized, writing better notes, maybe writing better
For the record,
communication.
that
But
is revolutionary for me, being better organized and writing better notes. For some of us, that is in fact a revolution of care. But yeah, go on, John. I'm sorry.
I mean, for me, revolution means like being able to do labs at the clinic. That's revolutionary. Like being able to, you know, digital X-rays were revolutionary. You don't have to like do the paper thing in the machine. Like, you know, I think we need to kind of put in perspective the technology, how it's helped. Be careful how we word things and not make it sound like it's this, you know, out of this world thing. Yeah, we need to use it. I hope telemedicine helps a lot of people. Really, you know, the point is that having your hands on that pet, having them in front of you at least once a year, it makes a major difference, and in specific scenarios even more, like the dog with the bladder stones.
Sure.
So, you know,
And
I wanted
I
to
think,
say, go ahead, Bill.
oh no, I think it's important for somebody like Lori Teller, by the way, to be pro telemedicine, right? Like to say here's how to do it right, not with
Correct.
respect Joe Spector, who doesn't do a lot of surgeries, as I understand, but like, but for Lori Teller to do it right, like that is different. Like there are vet students and young veterinarians who are like, no, this is somebody with credentials and clout is saying here's how to do it right, and that's important.
And I do want to say, and especially for you to know, John, I testified at a legislative committee hearing in Texas a few weeks ago, and they wanted to know if you could use telemedicine to diagnose screwworms.
Oh my
That
God.
would be no. No.
Hey,
You
put the
say that.
camera on the wound. Show me the
Yeah.
wound, and let's see the tiny, tiny little maggots that are there.
Zoom in.
Come
You
on.
say that's a really
Yeah,
nasty
like,
wound and you should go see your veterinarian, but that's as far as
wow.
you're going. I mean, this is a reportable disease that you don't waste time on.
But using that example is the level of confusion and the lack of knowledge that the general public has. That we are the ones that are the experts here, and we're the ones that should be deciding how we practice medicine.
Right.
Right.
Exactly.
And
it's
so
not
so right.
Not
So
no
for people like
telemedicine
me
for
that
screwworms.
are so for people like me that are like passionate about this and they really want to make a difference, like what first of all, where did you check the status of their VCPRs in their specific states? Where did you check if there are actually ongoing hearings and ongoing projects to change the law? And how do people get active in terms of, you know, getting involved and doing what they think is right for their state?
So definitely work with your state VMA. And of course, in Texas, that's the Texas Veterinary Medical Association. But every state has a VMA. You can definitely be active in that, be active in the advocacy component of that. Go to your state VMA's advocacy or legislative day. Our sessions are every other year, so odd number years. So we'll have a advocacy day here in Texas coming up in February to go visit our legislators. This will be one of the topics that we do talk about, those kinds of things. But work with your state VMA. You can certainly check your own state's practice acts and see what your VCPR requirements are. Every month or so, the AVMA releases a state legislative update. And if you're a member, you have access to that online. It's at no charge to you as an AVMA member. And they will highlight legislation in all the states that have been going on. So like Arizona just kind of loosened their telemedicine laws, but Alabama.
But then
Rhode Island just passed it. They became the 10th state to allow it. But then 2 states just tightened it and said you had to have an in-person VCPR to do it. So it's definitely being active in your state your state VMA, and working with them, with your state legislators can be a huge way to have a voice in this.
And then I have like one last question. You know, we're coming down to like the last minute. I was reading about the federal VCPR,
Mhm.
how does that relate to the state VCPR? Is there ever a world where the federal government can actually do a global VCPR that every state has to follow? Is that a thing?
So you do have to follow the federal VCPR. They are specific to what that agency does. So of course the FDA is their VCPR rules applies to extra label drug use. So if you want to use a drug in a state where there is a virtual VCPR available, like California or Arizona, that drug that you're prescribing has to be labeled for use in that animal, and you have to be prescribing it per the label instructions. Otherwise, you need to follow the FDA VCPR, which requires the in-person physical exam to prescribe the medication and use the drug off-label. And that includes OTC drugs. USDA's applies to certain biologics. And then for people who have horses, the FTC oversees HISA, the Horse Racing Integrity Safety Act. And so those all require in-person exams for the things that they oversee. And the FDA also covers veterinary feed directives for our large animal folks. So
Okay, it's good to keep that in mind too.
Yep.
All right, I think anything else, Laurie? You want to last minute message here for us and the public?
just thank y'all for having me. It's been great. Love visiting with y'all.
Thank you for joining us.
Yeah.
Thanks. Yeah, man, it's been a pleasure. I wish we had like 3 more hours, but I know that's not realistic. You know, I probably had to change my day quite a bit to do that. But
There you go.
I really appreciate the visit, and we'll look back at this and get some good pointers out. And like she said, if you really think the physical exam matters in veterinary medicine, and you're in a state that it's looking into changing the law and you want to get active, reach out to your VMA and get active, because you might feel like you might just be a good old veterinarian, but you are the expert and you're the person that gets to decide how veterinary medicine is practiced in your state.
Absolutely.
So that's my message. Anything else, Bill, Chris?
Thanks, Lori. Thanks for
Good.
joining us.
Thank
All right,
y'all.
thanks for joining us. We'll see you guys
day.
next month. All right, take
Okay.
care.
Take care.
All right, bye.
Bye.
All right.